Thank you all for joining. Today's the Neuroscience of Accountability discussion. Great job making time for this important work today. I'm Sarah Ernschwinder here at Tier 1 Performance and Tier 1 Healthcare. And before we jump in to hear from just our incredible presenters today, I just wanted to go over a few logistics. We will be recording the session today, so no worries if you miss anything. But as we get started, please go ahead and introduce yourself in the chat. We encourage active chatting throughout today's webinar, and hopefully you all have some awareness of our work here at Tier 1 Healthcare. But for those of you who are new to us, welcome. We're glad you're here today. At Tier 1 Healthcare, we activate strategies through people. Whether that's a patient experience strategy, innovation, or transformation, it can show up in a lot of different ways. And so it can look like telehealth experience design or the training around that, onboarding to set your new people up for success, or it can look like helping your people understand the why behind accreditation and regulatory considerations to ensure that culture of safety across the board. So in the case of today, it can look like how do you provide that team environment and experience that helps people show up every day to do their best work. We're incredibly grateful for the partnership we have with our clients to be able to impact healthcare in this way. So next, I'm going to turn it over to Dustin Schell and Richard Corder, my colleagues and friends. And as you can see on the screen, they both have a broad spectrum of experiences that they bring to the healthcare world. But if you ever get the chance to hang out with them, you should definitely talk to Dustin about his experience playing in a band with Taylor Swift's bass player. And if you're talking with Richard, ask him about that time he served the Queen of England a gin and tonic. This gives you a sense of their passion for connection and amazing experiences. So without further introduction, I'm going to turn it over to Dustin.
Thanks, Sarah. And just so you know, me and Richard get to be the face of this experience, but there's a ton of people who go into making something like this work. So kudos to everybody who put time and energy and love into this work. Lots of friends and family out there. So thanks for being here. We're going to just jump in here, guys. So we did a lot of research as we were getting ready for this work. And we find it helpful to kind of get outside of ourselves and look to other industries, other experiences. And one of the things that stood out to us was a guy by the name of Pasi Solbeck. And he's a Finnish educator. And he wrote a paper called Rethinking Accountability in the Knowledge Society. And what you're looking at is a chart of academic performance over the last decade or so. And what you can see is Finland is at the top of the game pretty much every year. What you might be surprised to know is that the way that they got there is that they removed all of the regulations against the schools. And instead, they put all of their trust into the local school districts and educators. He's quoted as saying, there's no word for accountability in Finnish. Accountability is something that's left when responsibility has been subtracted. And in fact, when he went to do his final conclusion, he said, schools and other education institutions should cultivate attitudes, cultures, and skills needed within creative and collaborative learning environments. Creativity will not flourish and be sustained in schools unless people feel secure to take risks and explore the unknown. We were just struck by this as an interesting solution to some of the challenges that face education.
Because, right, folks, good afternoon. Richard here. Again, to Dustin's point, great to see so many friends and family, and so touched and privileged you've joined us. When we look at performance, one of the things we then kind of hearkened ourselves back as Dustin and I were putting this together for you all was we've got some similar performance challenges in healthcare, right? We've got some similar outcomes that when we look at them against others across the globe, we could be doing a better job, right? It's no news to you all that we spend more money on healthcare than any other country, and arguably not as good outcomes as many other countries. And this is just one outcome. Look on the right-hand side of the screen. We have the highest rate of avoidable deaths in the world, and yet we're spending more money than anybody else. So needless to say, when we talk about data and we talk about our outcomes, I think it's fair to say that the stakes are pretty high here.
And the other thing is that what we were struck by is there's similar dynamics, highly regulated,
Right.
lots of public opinion, lots of structure and hierarchy in the systems, and it felt like a really natural connection.
And when you think about education and other things as well, it's pretty inspirational when you think about the rewards of doing it right are immense. So I think the other thing that we've found as we've done the research around accountability, this is not a new concept. And most of you who I know on the call today have grappled with this for many, many years. Kind of how do we become more accountable? How do we create more accountability? How do we think about it differently? Folks, this is a modern day photograph of something from 27 BC, I would suggest. The wild thing around ancient Rome was they had a tradition that I think is kind of really the epitome of accountability. When they lowered that final capstone of an arch into place in ancient Rome, that's where Dustin's moving his little cursor there, that the ancient Roman who had designed the arch would stand under the capstone as it was being lowered in. It was kind of this most profound form of accountability. And what are we now, 2021? So this is shy of 20. So over 2,000 years, we've been talking about this idea or this concept of accountability. So folks, our time here today, we're going to spend some time with you all thinking about kind of what does the brain need to be accountable, and we're going to start out by thinking about what does low accountability look like in our cultures, and then we're also going to walk through, and for those of you who know Dustin and I, we're having a hard time doing this, not being able to see you and touch you and feel you and hear you and walk with you and have fun with you. But anyway, we're going to do our best. Because as we wrap up here today, we're going to start actually getting into some tools to help you all show up differently and think differently about what it is and how it is that you create a sense of ownership and accountability for yourselves and your teams. So with that, what we'd like to do, right? Who's with me? Isn't this kind of what most of the time accountability looks and feels like, folks? Like Gary, leave it to Gary Larson to capture it in one picture, right? It's usually that bear through the sight of the hunter's rifle going, it's not me, right? You all know this story, right? You walk in a room and go, who's accountable for this result? And that's typically got a negative connotation in the conversation. So it's typically someone going, you might want to focus over here. So as we think about accountability, what we want to do is we actually want to start crafting some vocabulary or some language with you all. So we got a Mentimeter here. So if you go to the Mentimeter or pull up use the QR code, go to menti.com on your phones, use the code 2137755. And we're going to start kind of creating today amongst this group of folks that have come together to have this conversation. Let's start with, how does low accountability show up in the workplace? What does it look like? What does it sound like?
So while everybody's getting in there, Richard, you spent a lot of time in healthcare. What are some of the challenges or how have you seen this show up?
How does it show up? It shows up with...
Yeah, Esmail just put in the chat, low energy.
Low energy.
What else?
It shows up with people shoulding on each other. Do you know what I mean? It's like, we should have done this. We should do this. We should have done that. You should do this.
Shows up when they make excuses rather than solving problems. Yep, a lot of excuse. Low efficiency, avoidance, fearful to report, complaining, blaming others, always blaming others for personal failures, deflecting, hesitant commitments, poor response, blaming.
Hold on to that one, Dustin. Talking behind people's backs.
The blame game, making excuses, procrastination. Not my job. Sorry, I'm out. Disengagement, no decision making. We're seeing a ton of that right now. There's a bit of a pattern that happens where we get stuck in loops of talking about something, but not actually committing to progress. Low engagement. These are great. Let's go ahead and move on to the next question. And this is, so as we've been, as you think about those things like blaming and deflecting, what are some of the things that people are thinking that's shaping those behaviors? So next question, back in Menti, what's the internal dialogue going on in people's minds? What's the thing that they're thinking that makes it feel like what they're doing is not okay? Yeah, job security, insecurity. And insecurity can show up in lots of different ways. Maybe it's a perception of self. Maybe it's insecurity in terms of how they'd be received by others. It's not my responsibility. Afraid of repercussions. People are often afraid. Poor self-esteem. Yep.
I do
enough already. Entitlement. I don't feel supported. Fear of conflict. Yeah, and there's always something else that is more important. There's a lot of prioritization that can get us jammed up in our heads. Seeing others not being held accountable. So hey, I'm not as bad as the other guy. They're doing it. And inconsistency breeds fear. Exactly. I don't know what we're going to get. Let's go on to the next question. Thank you for everybody who participated here. I'm going to go to the next question. So here's a key feeling for the rest of this workshop. So I want you to spend a second. So we talked about blaming, complaining, avoiding some of those behaviors that show up outside, some of the internal dialogues. But what are the emotions that drive those internal dialogues? Our feelings shape our narrative, and our narrative shapes our behaviors. What are some of the things that people are feeling? We've already heard words like afraid. Are there any other words? Unheard, fear of failure, doesn't matter, apathy, helpless, frustration, failure, overwhelmed. I don't want them to think less of me. I'm burnt out. I'm tired. I'm frustrated. I'm anxious. For what purpose? Questioning. These are awesome.
I think the for what purpose is a really interesting one, Dustin. I don't want to lead the witness, but I got to believe that something's in there. It's like, well, why would I try again? Why would I do something different? No, it's never made a difference. Right?
Dog years negatively, 1 year is like 7 tiredness.
Right.
You feel like an old dog on the inside, maybe. Unappreciated, yes. So now the last question we're going to have for you is what experience have shaped. So emotions, beliefs, those feelings, they don't just happen, and they might happen in an instant. But the experiences that we have either in that instance or over long periods of time, they shape the way people feel, think, and act. What are some of the things people have experienced over time that have got them to this place? Learned behaviors. Elaborate on that if someone hasn't typed. I'd love to hear more about what those learned behaviors were. What experiences have they had? And these could be people interactions, childhood. It's a great call out. Retribution. Maybe they've done something. Maybe they have spoken up and there were consequences to it. Maybe they've experienced somebody, Shirley's out there saying negativity, lack of trust, culture, seeing others get away with doing nothing. So they've experienced. What was that?
The legend about people who've spoken up in the past. You hear it all the time, right? Oh, you remember the last person that spoke up? They don't work here anymore.
Yep.
That legend.
So the stories that are told, empowerment or lack thereof, negative reinforcements. So we're using a lot more sticks than we are carrots, and the carrots we're using might not be motivating the right things. Being a satellite site, regularly feel, think, 2D class to mothership. Oh, second class, yeah. Yes. I thought we were talking about 2D, 3D video. Tired, nothing changed, no one listened. And guys, thanks for playing. I appreciate you doing this. What this does, it helps us start to name some of the dynamics. And what's interesting is we knew we didn't have to tell this story because you guys are ready to tell it. You live it every day. I'm going to go back to the deck here.
It's important, guys, and I want to repeat what Dustin just shared. And if you go to the next slide, Dustin, the experience we've had shape our emotional memories, guys, right? We don't just act for the sake of acting. It shapes the way we think and act. So our experiences, those experiences you were just articulating, shape the way we think and act. So when we think about the model that we share here with you, it's kind of your experiences have formed the way you feel, inform the way you think, result in your actions, and that's what's getting us the results today. The notion here of feelings trump actions. So if we want different outcomes, we actually have to think about this and pay attention to this tension between the logic thinking actions that are going on versus the human feeling that's going on. It's really important to spend a little bit of time on this as we think about this reality that our experiences in the past up until today are shaping our emotional memory. And it's with that we're creating this kind of Gary Larson-like reality of don't point it over here, point it over here. There's also a fascinating piece of work, several pieces of work going on right now around the difference between Eastern and Western ways of thinking as we think about leaders, and this tension between the logic, thinking, action of typically what a Western is in the Western mindset versus a more human or a more feeling approach to how it is that we show up as human beings in this tribe of human beings. And at the risk of no, not even at the risk of, we're going to be spending some time with you all in this space of the emotion, the feeling. And so with that, it poses this question, therefore, okay, where do we want to be? If it's not this accountability of, it's this guy over here, it's not me, what do we want in the future?
We want to appreciate that this feels really far away for a lot of people. I mean, we're recently doing work with a senior leadership team, and we were checking in with them, and somebody spoke up and said, "This feels a little more touchy-feely than I thought it would be. Can we get back to work?" There's this real avoidance to emotion at work, and there's a lot of history of emotions being extracted from work. And so, but beyond that, the other thing that feels far away is the different results. I think if I did another Menti, the things that we would see would be like saying unicorns and rainbows as results, because it just feels so far away from where we're at. What do you mean trust? There's so many problems to fix, so many things that need to change. How do we get there? And so we thought it would be helpful for us to paint a picture that there is hope. In fact, a recent study was done by a neuroscientist on high-performing organizations compared to low-performing organizations. And guess the one word that predicted the differences between these numbers? More energy at work, more engagement, lower stress, higher productivity, lower burnout, higher satisfaction, less sick days. Trust. It all comes down to trust. And so this workshop is going to be a big part of how do we foster trust and secure relationships on a team? And so I actually goofed on this slide here, but before we get to that slide, I want to ask this question to the group. We're going to go back to Menti, and there's something going on, and we've started to ask a question that's really starting to help us appreciate that difference. So go back to Menti and answer this question: if your organization were a person, use one word to describe its personality. While we're getting results here, I'll share, there's a lot of questions about why. Why is this happening? Nobody shows up to work wanting to do a bad job. What's the one word? High achieving, competitive, bipolar, anxious, multiple personalities, chaos, commanding.
You got kind,
striving, predictable, fearful, commanding.
Put them in the chat, guys, if you can't get into the Menti.
Yep. Forcing culture.
Obsessed with results, anxious, fearful.
Richard, we've asked this question to a couple different organizations. What are some of the things you're seeing that are not here as well? Or what's striking you about this list compared to the ones we've seen?
that in the healthcare organizations we ask, these are the words we see. And for me, it's the epitome of the oxymoron when we think about the words health and care. Anxious and fearful and multi-personalities and self-centered and bipolar are not healthy, caring words. Now, don't get me wrong, there are some healthy, caring words in there. There are some beautiful words in there, but it's this dichotomy, this bimodal reality of what we're trying to do. And we see it over and over again. And our friends today didn't disappoint. And the story of two companies, most hospitals we spend, most organizations we spend time in are talking about, we put our patients and caregivers first. It is written on our walls. It's where our mission, vision, values live. And you hear people in new hire orientation say, we're a family, we care about you. And then you hear people tell us stories about what the work's really like. And you're working me to the bone and you're not protecting me. And I'm afraid of what will happen if. And all of those experiences that everyone today just shared, Dustin, I'm afraid to speak up. I'm afraid of retribution. It's just this two stories, the tale of two companies.
And this is where the narrative starts to continue to shift towards optimism. But first, a little bit of an interesting sidestep. Check this out. So this book called Stop Walking on Eggshells. You guys heard the language of multi-personality disorder. You heard bipolar. Well, this book was written for people who live with people with those conditions, and look at the kind of behaviors that those people start to show up when they're ready to make a change. Look at the headline there, Taking Your Life Back When Someone You Care About Has Borderline Personality Disorder. That book is written for that person in that situation, deciding to make a change in their own realm of influence to make things better. And that's what the rest of this workshop is about. It's a message of empowerment to every leader, no matter how big or small your team is, no matter if you're working for an organization or just for your small little space. This work of leading teams can happen at any level, and these skills for the rest of this workshop are going to help you get there.
And it starts, guys, with getting clarity. I can't get to a place of improved accountability, improved trust without clarity. I can't demystify culture without clarity. It's the clarity between what we'll no longer stand for or tolerate and the clarity of what we will stand for and what we do believe in. And our industry is shifting, ladies and gentlemen. And there are folks on this call today who I've heard it come out of their mouths where they can bravely articulate that we want to move from this space of the mandated top-down space that is the hierarchy to the adaptable, human, organic, bottom-up. We're having rich conversations and we are succeeding without too much maintenance. And what we'd like to walk you into and with you today is this, the bridge across that gap, the shift that we're gonna, I think, individually going to invite you to take is one of building trust and vulnerability. And so then the question becomes, how do we do that? But this clarity in this space so that we can help people feel secure in their work, to kind of embrace trust and embrace vulnerability is step one, if you like.
So for all the geeks in the room, this is when the fun happens, because we've gone, we leave it to Richard and Dustin to go 27 minutes in, and we promised neuroscience and haven't given you one nugget.
Take the screen down, Dustin. Let's go.
So here we go, guys. There's a couple of things that the science has learned about the way the brain works, and psychologists have proved it even before brain scientists did. I'm going to stop sharing my screen. But for those of you following along at home, I want you to hold up your hand like this. Okay. And I can't see you, but do it for you. This will be a helpful kind of like tool for you as you're helping your teams understand what's going on. Put your thumb across your hand like this, your 4 fingers up, and don't do this. That's V for Vulcan. Do this. Okay. This is a crude representation of the brain. On the inside, your thumb, this is your limbic system. This is the emotion center of the brain. It's helping your body, helping the rest of your brain make sense of your desires and your needs. Its essential question is, am I safe? Okay. Your four fingers on the top, that's your neocortex. This is the thinking, logic, self-control, reasoning, decision-making, all those other things. Now, here's where the limbic system is so important to understand. There's a couple things as leaders you need to know. First, this can hijack the rest of your brain. If it does not feel safe, it goes into fight, flight, or freeze mode. The other thing you need to know is your limbic system can't tell the difference if you're home or if you're at work. It doesn't know the difference. And so for us to think that emotions don't belong at work, your brain has a different story to tell there. And then the other thing to know is that your limbic system, so this is, it's a phrase called false positives. It favors false positives. So I'm going to turn my presentation back on here. And what I want you to see is that the limbic system is a lot like a squirrel. Not Richard, a squirrel. And it's not very bright, and it's hyper attentive to danger. It wants to assume that there's danger and be wrong, than to not and be dead. And it's constantly asking these two questions. It's kind of like if you're walking through a field and you're having a good time, and then all of a sudden you see kind of a wavy thing on the ground, and it's slender and it's brown. You're like, oh my gosh, it's a snake. And you kind of jump. That's your limbic system hijacking everything else going on in your body and saying danger. And until your brain calms, you're flooded with cortisol, you're flooded with adrenaline, you can't think straight, you've got narrow focus, you feel in danger. And so that's a good example of it favors a false positive. Same thing happens for, like, let's say your boss walks down the hallway. The only time I see my boss is when something's wrong. So guess what happens? Snake! Not really a snake, but you get what I'm saying. Your brain says, I think it's danger. And if something in my environment doesn't start to tell me a different story, I have the same stress response. So it starts to look a lot like this. So am I safe? And then it starts to ask this question, what's next? I need clarity. I need predictability. I need consistency. I need agency. I need to know I'm in control of my destiny here because I'm afraid. And when I do feel triggered, that's when the fight, flight, or freeze response comes in. Stress hormones come out. And here's what happens. Muscles tighten, heart rate increases, energy sends to the limbs, increased sensitivity to pain, narrow focus, loses focus. We take less initiative, appropriate risk taking. We have a hard time remembering because we're so focused on what's in front of us. And this is where we also start to see some of those fight responses. So in the literature, it's called protest or defensive behaviors. So when people start to blame, when people start to say, not my job, those are a combination of fight or flight or freeze responses because they don't feel safe about what's next. And this is where the next part of the conversation comes in. The other part of what your brain is doing is it doesn't understand. The limbic system is wired for human connection. So just like the stick and the snake, and just like the boss coming down the hallway, when we don't feel connected to a tribe, when we don't feel connected to a group of people that we're with or connected to an individual, it sends the same limbic response as if it were real danger. And so the connection part of your brain is saying, how am I doing? Are my relationships okay? Am I getting positive cues? So if you guys have been in lots of Zoom meetings, something I've been hearing from leaders is, I never noticed how I showed up in meetings until Zoom meetings. Do I really do that? Do I really look like I'm sleeping? The cues that we send each other are actually triggering our limbic system, because what it's saying is, I'm not doing okay because my boss has got his head down or my boss is rolling his eyes or whatever it is, because we're looking for that validation. It's okay, I belong. So let me tell you some of the science here. Psychologists did a study. This was a guy by the name of John Bowlby. He's foundational in the world of attachment research. He did a study during the time of World War II. Essentially, there was an orphanage where kids between the ages of 1 and 3 were dying. They had food, shelter, clothing. They had some attention, but very little contact with other human beings, especially adults and a key caretaker. They were dying and they didn't know what to do. So they brought John Bowlby in, and he took more of, he started studying what was going on. And essentially, he discovered that we are wired for meaningful human connection. In fact, he said, we are seeking and maintaining contact with a secure relationship is viewed as the primary motivating principle in human beings, an innate survival mechanism.
And guys, it's different than the choice of being alone versus truly being lonely.
Yes.
Intentionality of being alone, which is incredibly healthy and meditative and can fill your bucket. What folks will sometimes push back on is say, well, I actually enjoy being alone. I've intentionally put myself into that. That is different than what Bowlby was studying. What he was studying is being alone when you know you have a network that you could access is actually subconscious to true loneliness. And as Dustin was explaining, these kids were dying because they were lonely.
They craved connection. There's a whole bunch of research now about how social isolation is a leading cause of suicide and depression. And it's gone up even since COVID for this exact same reason. We have hundreds of followers, but no real connection. And so there's a guy by the name of Don Ream, awesome dude. In fact, he's leading the pack, I think, in terms of connecting some of what the psychology and neuroscience people have been doing in the personal realm of counseling. And he's starting to bring it to the workplace. What he says is threats, real or perceived, activate the attachment system, which drives us toward a protective figure such as a boss, leader, or parent, seeking reassurance, clarity, direction, and protection. Secure relationships, cope with threats, and maintain focus. Essentially, we soothe that limbic system. Then, so let me just pause there. This is huge, guys. This is life-changing, and I can tell you from personal experience, this is the kind of insight that doesn't just change your team, it can change your whole world. In fact, my wife and I started a counseling practice. This insight here, recognizing the role you play in another person's life to help soothe their limbic system and feel like they belong, can help, is the difference between them worrying themselves to death, literally, or feeling secure enough to move forward. It's huge. The neuroscience came along later and says, yep, they were right, basically. But I think it's an interesting insight. Social baseline theory was a guy by the name of James Cone. James Cone believed this, but he set out to really appreciate and understand what is actually happening, and can I prove that we are wired, the limbic system is wired to crave social connection. And so he designed this experiment where basically he brought people into an fMRI machine, and he said, I'm going to shock you a couple times, basically. And he had three different groups. He said for one group, they're going to be alone, and I'm going to shock you a couple times. And he measured what was going on in the brain in the limbic response. Then he measured what would happen if I had a stranger hold their hand, and what would happen if I had a loved partner hold their hand. And he just studied. And here's what he found out. Our perception of threat and pain decreases with the presence of a trusted partner. There's a lot of interesting things here, but essentially, what's so amazing to me is that literally, this is why I call it social baseline. If our baseline for pain and anxiety and fear is here, just literally being in the presence of someone we trust, that pain experience goes down. So when we talk about resilience, what we're talking about is, do we trust each other enough to weather and experience more difficulty together because we trust each other than if we feel like we're alone, even though we're surrounded by people?
Which Dustin is a point, and it's been called out in the chat, and I think we're certainly not we're not talking about it, but it is the reality of last year, right? In addition to the devastation of people's lives lost with the pandemic that we're I think coming through and out of, thank God, the isolation, the lack of human connection with ones we love has had and will continue to have a toll, not to be made light of by. So I just, it's real, and is getting called out in the chat. It's our shared lived reality right now as a world.
So let's get to the practical space here. But before we do, part of what what we need to do now is talk about what a secure connection and insecure connection looks like. So we talked about that fight, flight, or freeze response. Well, when we feel like we're in a secure connection, kind of like that trusted partner holding your hand, what happens is when your brain is asking that question, what's safe? Am I safe? It's asking those what's next, or what's next, how am I doing questions. But from a connection perspective, it's saying, are you there for me? Do I matter? And if I can answer yes to those two questions, it soothes my limbic system. I release oxytocin, and it makes us resilient. So in contrast to the fight, flight, or freeze response, oxytocin, your muscles relax, your heart rate decreases, you decrease sensitivity or even awareness of pain. You have clarity of thought. Research has even proved you have increased empathy and vulnerability, increased pro-social behaviors, engagement and support, and you have the ability to communicate your needs. There were so many examples of like, why won't they speak up? This is why. When we don't feel safe, we don't feel like we can share. Compared to an insecure connection, where you have a triggered limbic response, releases stress hormones, and it promotes fearful behaviors, those fight, flight, or freeze responses. And so this is the core foundation to everything that we're gonna bring home here. So when we talk about nourishing accountability, the key to ownership is a secure connection with you. It feels so simple when you say it out loud like that. So, but what's cool is we have we basically borrowed from a couple different fields of study. In particular, attachment theory has been applied in the counseling practice with parents and romantic relationships. And what our team has done is we've started to curate the best of that research as well as our own understanding of organizations and leadership, and we're gonna bring it to the workforce. Okay. And so we're calling it Leading at Secure Teams. And you should have access to a tool.
Is it in the chat?
It's a personal assessment. There's lots of ways you could use this, but the one we're going to use today is just to be a mirror.
It should be. Not in the chat. It'll be sent to you. It's an interactive PDF. And it's an opportunity, as Dustin has said, to kind of start with yourself, but to kind of nourish this kind of nourish the accountability, kind of give you some time to be able to think through how it is that we create what we're going to share a little bit more with you about a secure base so that it's safe to leap. So there's two parts to this. It's kind of a self-reflection, as Dustin has said. It's a mirror. So you can either open this now and follow along as we're going to go through unpacking the model. You can print it off later, use it later. It as an interactive PDF, it works best if you don't do what I would do and print it off and use it later. Dustin's going, no, don't print it off, use it online, you Luddite. And then on the flip side is actually put it into practice. Okay, what does this sound like? What does it look like? And how does it help? And again, as Dustin so beautifully articulated for us all this afternoon, this is based in how it is that our brains are working. And I love the reminder, Dustin, that your limbic system doesn't actually know whether you're at work or at home. And yet the burden that I see friends and colleagues carrying, that is this kind of switch between, well, that's the Richard that goes to work, or that's the Richard that stays at, that doesn't go to work. That load is a heavy set of filters that you are working hard to try and push against something that is a little bit more powerful than that, your brain. So why don't we get into unpacking this model, Dustin? I think we've got this in the chat for folks. Yeah, you'll see it in the chat. There's a link there for folks.
Okay, here we go. So essentially, this is think of this as a cyclical nature, and what you're looking at is on the inside of that circle is your team member's experience. So in all of us are in the cycle actually, but we're looking at it as you are the hands, and you're looking inside to take care of your team member. So the first thing you have to appreciate is all of us are ready to leap, and we want to feel safe enough to leap, to explore. And when we do that, when we try new things, so we want people to take a risk, to own something, even when it feels risky or ambiguous. What the person is saying is, support my exploration. As I'm doing this stuff, I need your support to feel safe to leap. But when you do that, inevitably it starts to feel wobbly, insecure, hard, difficult, challenging. And when that happens, you need to have a safe place to land. And when you're coming back, the person is asking, will you welcome my return? So when things are at the hardest, can I count on you to be a place that I can come back to? And in all of that, there's kind of 3 skills that leaders have to learn. One is, on that safe to leap side, you need to be a secure base where it's safe to leap, and a safe haven where it's safe to land. And in between all of it, you need to have vulnerability to show up and model what it looks like with them, but also understanding that you are also on your own journey. You have to be able to model it, model what it looks like. And so let's unpack what support my exploration looks like. So when they're saying support my exploration, the literature talks about it in kind of these categories. We've adapted it to more of like a peer-to-peer relationship, or a reciprocal relationship, not a parent-child relationship. That does not help us as a leader. And so here are the needs. They're saying, inform me, provide context and clarity, challenge me, help me reach my potential, encourage me, help me feel seen and cared for, and guide me. Help me navigate complexity. And there's awesome questions in that questionnaire to help you kind of unpack what that looks like. Those are pulled from evidence. Those are not ones that we're making up. And here's what it looks like.
Sorry, Dustin. What's important here, guys, is this tool, this model is not something we go back to work with. If any of you have stopped for the day, God bless you. But it's not something you go back to work with on Monday and say, hey, I went to this really cool webinar on Friday, and this is what you're going to do. Right? What we want to share here is this is to be internalized. This is for each of us. And so what the secure base in practice sounds like is, I'll support you in accomplishing your goals. What that ends up looking like is it's an invitation or a space for you to think about, okay, resist the urge to solve someone else's problems. Like, help. It's like, for anyone that's raised kids, it's like, let them solve it out themselves. And then consistently not reacting harshly when things go wrong. It's like, to Dustin's point earlier, like, don't react to that piece of wood as if it's a snake. That takes practice. And then acknowledging your own needs and gaps and being vulnerable, can't even say the word, vulnerable enough to ask for help. This results in you will create this reality that makes it easy to explore threatening situations. Folks feel more comfortable letting down their defenses. They're open to new behaviors, and it's a far easier space and place to cope with the setbacks that befall all of us.
That's awesome, Richard. So in recognizing that this is a cycle, and at some point when they feel safe enough to leap and they take that leap, on the other side of it, they need you to welcome their return. And it looks like, protect me, create a safe environment. So I saw in the chat, somebody talked about the 4 stages of psychological safety. We're going to talk about that in a second, but it is a lot of that. Create a safe space, nurture me, help me process with perspective, prioritize me, be present, invested in my growth, appreciate me, celebrate who I am and what I contribute. I would say the literature actually says, like, who I am over what I contribute. It's more about who I am as a person. Recognizing we're in a high performance world, we can also care for the person no matter what happens to them after they're done with your team. So Richard, paint a picture for what this looks like.
The picture here is it sounds like, I care about you even when things don't feel so great, right? I care about you even when you don't feel so great about yourself. Some of the things that we can do in this space as leaders is as difficult as time is to find, but schedule one-on-one time with each member of your team to learn more about what's going on in their world, not just about work. Someone had a great comment in the chat. Sometimes work is actually safer than at home, but take that time to understand what's really going on in people's lives. This, if you take nothing else away from our time together this afternoon, the second bullet is a safe haven in practice is to lean into this. Stop talking talk to people, don't talk about them. If you don't gossip, right? Take the mail to the right address. but stop people from telling stories without going to the source and understanding what the world is like through their eyes, or what the world is like as their lived experience. And next time you see a team member's strengths, and I know for a lot of us that are just used to kind of the binary world of strengths and weaknesses, but you'll know what your team and you do well. Go celebrate it. Go celebrate a strength and call it out specifically and in real time. And we create this reality where people feel confident and understood and validated and supported and cared for and celebrated. So that's that kind of, that's a way. And you're going to see in the tool that you downloaded, there's a bunch more ideas about what it sounds like, what it can actually practically look like, to kind of help you on this journey.
And something I'll say here as we're transitioning is that this all takes practice, and it is a skill. In fact, if I could use the love word, there's the psychologists, psychiatrists, counselors, they use the secure model as a way to talk about this is the skill of love. And so when the challenge with it is that it takes vulnerability. And so that's the third skill. You see those lines on the inside and on the outside. Well, let me paint a picture. There's a really tough reality here, but a good distinction is that it's hard to be vulnerable, because on one side, you have to give trust. Will you give others the benefit of the doubt? Hey, Bob's probably going to freak out if I disagree with him or if I show him something that's not perfect. But you have to be able to do that with your team. And you can see how that shows up in Safe to Leap and Safe to Land. But you also have to appreciate on the outside of within your team and in your organization, there's this word called psychological safety, where the question is, will others give you the benefit of the doubt? So you are also having to kind of keep yourself in check. My team, here's a positive frame on it. In some organizations, my team expects me to speak up. It's how we do things. But if that's not the case, it's a hinder to you showing up in your as a vulnerable leader. And so I think we need to appreciate. So the last part of the reflection here is we need to appreciate that we are part of an organization where there are some social norms. And actually, I saw in the chat, somebody mentioned Timothy Clark's book, 4 Stages. I love what they're doing. I love the way he's talking about it. He's got some cool resources too. And the questions even. So he asked kind of these 4 questions. And I think this is a great mirror for us to kind of get a sense of, in terms of the law of the lid and our leadership ability or our vulnerability level, where do we stand? And so, but what he says is that vulnerability, there's increasing amount of vulnerability at every stage of safety. And so you need to, so the reflection in there is to give you a sense of how you show up. There's some really cool neuroscience here that I was going to share, but we're kind of running out of time. But I'll just share that the finding here is that creativity and vulnerability is more about letting go and giving up the need to control ourselves, so we're not as inhibited and more willing to make mistakes. So we're not constantly shutting down impulses and ideas. His whole research, this is Charles Limb, was basically to say that creativity and vulnerability already exists within you. You just need to stop controlling and let it out. And a really cool study. You should look it up sometime. But in the reflection, if there's space to grow, or if there's things you guys want to put in practice, Richard, give us a sense of what that looks like.
So really sometimes straightforward, but find someone that you can be yourself with. Kind of, for those of you who have had the privilege of working with, I talk a lot about kind of finding your tribe, find your friends, recruit them on your journey. Treat your team like volunteers is a really interesting brain space to walk into, right? Puts you in a posture to grow with them. What if they could go volunteer somewhere else? And for most of us on this call today, we're doing the hard work that is healthcare. The mother of nursing, Florence Nightingale, gave us some of the best advice ever. Proceed until apprehended. Try asking for forgiveness instead of permission. I get it, not always applicable, but certainly a little freeing. And one of the biggest gifts we give to ourselves and others when we think about the clarity needed to form some of the space and places to leap and land that Dustin has described is revisiting what your definition of success looks like, and or what your definition of success for your team looks like. And kind of be brave and candid with yourself. What your definition of success was at 18 when you were getting into college versus what it is now at, you fill in the blank, are likely 2 different things. And for many, many people that we work with, when you kind of get down into it and you start unpacking it, one of the reasons they can't be vulnerable with self or others is because they haven't actually owned up to this shift that's gone on. So that's a whistle-stop tour, guys, through the model. It's for you to use it as how you want to use it. It's an incredible, I think, just kind of tool and reflection place. So too is the workshop. We want to bring this home for you, and we'll leave some time here for questions. A lot of you are talking about high reliability. I hear in almost every hospital that we are blessed to be able to work with. And the question is often, what role do trust and secure relationships play? And I just we thought we'd bring it home and reframe this slightly for you. First principle of high reliability is a preoccupation with failure. I would offer you that if you make it safe to leap and land and model that it's okay to fail and learn those lessons, you are becoming preoccupied with this notion of failure. The second principle of high reliability is a reluctance to simplify. Again, based upon what we've talked about this afternoon, if you get safe and comfortable for yourself and the teams that you lead and the teams that you work with, to, with some degree of comfort, not always easy, but to challenge these long-held beliefs that we've had in healthcare and medicine and embrace the complexity of organizations and people, you are getting to that kind of that nirvana, if you like, of reluctance to simplify. Don't simply default to the answer that you've always found, or to the practice that you've always followed, or to the policy that you've always pursued. When we think about sensitivity to operations, make the effort to experience work as done, right? Like, get real close to it. And if you've created a space where the front line feels safe to speak up and try new things on their own, you're being sensitive to operations. The full principle of high reliability is this notion of commitment to resilience. And my goodness, folks, if anyone's been resilient over the last year, crying out loud, it's healthcare. But if we extend trust, if we remove the barriers that we hear are created, usually with no malintent, and build teams that, as Dustin has articulated, that can leap, change, and adapt together, we will be even more resilient than I think we can even imagine. This deference to expertise is not how it's often ill-formed or ill-thought of in healthcare. But if you let go of this notion of your own expertise and be ready to learn from others, and be ready to learn from folks, not just elsewhere in your organization, but dare I say, elsewhere in your lives, and then trust those folks to decide and trust them to act, it is a deference to expertise. We thought that winding and kind of weaving this together with high reliability would help you find and see how it is that trust, secure relationships, a personal commitment to the clarity required for an environment that is an accountable one, it lives in this space of creating safer, more reliable, more effective healthcare.
Awesome. Thank you so much, Richard and Dustin, for sharing everything. For the sake of time, I know a few folks have to jump. So thank you all for joining today. We do hope that you will watch for the email. We'll share information about our upcoming schedule, as well as the links to everything. But let's dive into one question that came up from Paul, and then some of the others we'll save and answer in the follow-up as well. But simply put, he asked, why is this so hard for us to do in the workplace and at home? If it's so rewarding, why is it so hard? The $1 million question.
Oh, dude. I think it's so hard because it feels so important. And when you talk about the need for survival, a lot is on the line. And when things feel heavy, it feels hard. And there's a lot working against us in terms of we bring a lot in our backpacks to every moment. You know, someone said how we were raised, our childhood, that's in our backpack. Some of us, Mental Health Awareness Month is in May. Some of us are predisposed genetically to worry more than others. There's lots of things that make it hard for us to trust each other. And to add on to it, the organizations and healthcare, not just healthcare, but lots of organizations have spent the last 2 centuries separating emotions from work. And so we don't have a lot of practice at it. I guess that's my response.
I just plus up what Dustin said. We grow up in environments and cultures that say that you've got to conform, you've got to fit. There's a certain script you've got to abide by, a certain set of rules, and not to say that we throw those rules out, but there's a certain false narrative I would offer that's gone on, that said, you've kind of got to put on a certain mask, you've got to put on a certain costume, you've got to put on a certain way of doing, being, thinking, acting, feeling, and this invitation to show up differently is a very new one. And so I think it's a great question, Paul. I think it takes practice and it takes modeling, and there's some great pieces of work. I think it's Brave New Work, right, Dustin, where the author talks about looking at how organizations are organized, how firms are organized, and we're still organized the way we were in the 1800s, with hierarchy and rules and policies, and you will do this and you won't do this, and yet we've changed how work's done. We've changed, and so anyway, so I think it probably took since ancient Rome to get this broken, and it ain't going to get fixed overnight. I think that's probably how difficult it is, Paul.
Thanks for the question, Paul.
Great question.
Thank you. So, well, that wraps up today's webinar. If you want to dive into any of the content or talk with our team about any of the strategies or initiatives you're facing, just reach out. We always love to connect, and just wanted to say thank you for all the work that you're doing each day out there in healthcare.
Thanks, guys.
Thanks, everybody.